In Jawoyn country, around Katherine, everyone knows this dancer as Little Chappie. He's the son of one of the elders of a community that's determined that their children in the Northern Territory should have the same health and opportunity as other Australians. By using their cultural assets and sharing in the tourism that brings visitors to their land, the Jawoyn are gaining control of their lives and challenging the prevailing sense of hopelessness that's created welfare dependency and a health emergency in Aboriginal communities.
I saw the incredible poverty my people were living in. I just knew that I had to at least contribute something to try and improve that situation.
Taken away from her home as a child, Irene Fisher now has the enormous challenge of organising a health service in the Jawoyn communities east of Katherine. Were you shocked at what you saw when you found your own people, your original home?
I still haven't become desensitised to the whole thing. It was a total culture shock. And I've been back for 13 years, but I still at times find myself feeling distressed when I just see the misery of some people's lives. It's the compounding factors of poor access to health services, poor nutrition, overcrowded housing and poverty. And these are problems that some of the profiles in Aboriginal communities are comparable with Australia 100 years ago.
If you listen to the Jawoyn people, the health crisis in Aboriginal Australia is in many ways a development emergency. These people do not have the most basic services that most of us take for granted, especially decent food and shelter. In summer, it's around 40 degrees here, so how can you keep food fresh when only a handful of these houses have a refrigerator that works, let alone a washing machine or other basic services? So the Fred Hollows Foundation is working in partnership with the Jawoyn to try to build up the many things that are needed to make a community strong.
Well, if you have a look at almost any Aboriginal community anywhere across the country, they're totally lacking in things that ordinary Australians take for granted, namely things like preschools, a decent shop, access to services, primary healthcare services, access to a chemist. Then when you start to add to that the fact that Aboriginal people are the poorest, they have the lowest level of income and invariably live in those sorts of areas whereby the cost of living is the highest. All of those factors combined, I think, contribute to the underlying poor health situation for Indigenous Australians.
In Woogala, strong and determined Jawoyn women told the Hollows Foundation what this community of 300 people wanted. Kids weren't eating right from the time they were babies, so a nutritionist provided by the foundation helped them start on the fundamentals of strong health. They've been cooking hot, nutritious meals for up to 120 school children each day. If you weren't giving the kids this one guaranteed meal a day, what sort of tucker would they get back home?
Nothing. Yeah, they get nothing for things. All us women got together, all the mothers, all us Mabo got together, and we formed this feeding program now for our kids.
A preschool for the youngest Aboriginal children was unheard of in these parts until the Woogala community decided their children needed better preparation instead of just being dropped into primary school with all of the language difficulties and culture shock. Now, dozens of young kids start each day with a nutritious breakfast.
Now we'll read the Three Little Pig, okay?
They also get the play and preparation needed to improve the current literacy rate of 7%.
But the third little pig worked all day and he made his house up. Good.
They are trying to build up the condition of the children even before birth by improving the nutrition of pregnant mothers. And then they work hard in the infant years to strengthen the immune system against chronic illnesses. By starting early, the Hollows Foundation believes there's a much better prospect of reducing the lifestyle illnesses of obesity, renal failure, diabetes, strokes and heart attacks that now see Aborigines dying at more than 5 times the national average.
It makes a big difference. I mean, 2 years ago, having a nutrition person through the foundation, working on the ground with people, listening to people, what people want, we never had the ownership. Government were telling us what's best for the last 50 years. What's good on our health, what's good for our education, what's good for this, what's good for that. There wasn't any proper training package. No one was listening to what people were saying, particularly Indigenous people.
And the gorge system itself is only about 25 million years old, because the gorge used to be a part of an ancient river delta system till an upheaval.
With 500,000 visitors coming to Nitmiluk Gorge every year, the Jawoyn are getting closer to their goals. This beautiful place was handed back to the traditional owners a decade ago, and after the success of the tourist venture, the Jawoyn soon will buy out their business partners. In Manyaluluk, visitors come from around the world to learn a little of what the Jawoyn know about this country. This is another tourist venture that's proving so successful it's called for a very rapid learning curve on how to manage a growing business.
Money story.
Peter Bolgi, the Manyaluluk Council President, presents his financial reports in a unique money story, a concept that recently won a National Business Award. This initiative, supported by the Hollows Foundation, was developed by Hugh Lovesey after the Jawoyn store operators said the visual story helped them master very complicated concepts that could be the difference between profit and loss.
People believe that Aboriginal people can't handle money. It's totally, utterly wrong. The thing that needs to be done is to put the concepts, which are not difficult to understand, in a universal language. People understand those pictures and they can begin to grasp the concepts of financial management.
Many of them, I think, are, enormously dedicated women in particular, who do amazing work, who do it with a real clarity, I think, and a sense of purpose about knowing that these are the things that need to be done, and they're prepared to get out there and do it. I also think that there's this perception that somehow Aboriginal people sit around passively waiting for others to come and do things for them. And clearly that's not the case, and it's certainly not been the experience of the Foundation in the work that we've been doing with these communities.
On one unforgettable night near Beswick Falls, the Jawoyn opened up a sacred place to share with anyone interested in their culture. These Jawoyn people have made up their minds that despite the difficulties ahead, there are many things worth living for.